That's not, he's elected by Korean people, you know.
Yeah.
Why it's more, give a lot of money to Kim Jong-un. That's why he developed nuclear weapons, you know that. Then we have a hard time for them nuclear weapons he develop all the time. That's why he just, next time.
Hello, everyone. Happy Thursday.
Yeah, happy Thursday. Friday.
So as you all should know by now, we are focusing today's press briefing on the department's efforts to combat the COVID-19 pandemic. And in line with those efforts, today, Deputy Secretary Hicks and the Vice Chairman of the Joint Chiefs of Staff, Hyten, released a memo on, quote, methods to enable and encourage vaccination against COVID-19, quote. To speak about this and the department's efforts, broader efforts to defeat COVID-19, we have two familiar special guests with us here today. Acting Assistant Secretary of Health Affairs, Dr. Terry Adirim, and Lieutenant General Ron Place, the Director of the Defense Health Agency. They will deliver opening remarks, and then we'll take a few moderated questions. And so with that, welcome them to the stage.
Thank you. All right. Good afternoon, everybody. Thank you for joining us here today, and thanks for all the important work you do communicating with our troops and their families. General Place and I are going to brief you today on DoD's efforts to combat COVID-19. DoD is continuing to play a key role in supporting the whole of government approach to defeating COVID, including supporting vaccination of our fellow Americans while ensuring our own population is vaccinated. To date, we've administered over 3.3 million doses to eligible DoD personnel, with 58% of our active duty service members having had at least one dose. Note that 1 month ago, when we opened vaccination to all, we were only at 37% of active duty service members receiving one dose. So we're making good, steady progress. I also want to note that our active duty and National Guard have to date administered over 15 million doses of vaccines, and we thank them for their hard work in advancing vaccination across the country. Since the start of the COVID-19 pandemic, DoD has had nearly 300,000 cases, just over 4,000 hospitalizations, and unfortunately 351 deaths. These are total numbers that include our military service members, their dependents, civilians, and contractors. It's also important to note that COVID-19 infection incidents and testing positivity rates for DoD personnel are lower than for the civilian population, which is a sign that our force health protection measures are working. With last month's expanding of eligibility of vaccination to all DoD service members, personnel, and beneficiaries, the department has redoubled its efforts to encourage everyone to get vaccinated. In fact, as Jamal mentioned, the Deputy Secretary and the Vice Chairman of the Joint Chiefs of Staff issued a memo today to senior leaders that reaffirms the importance of vaccination and identifies the tools for effective vaccine encouragement. These tools are already in widespread use by the services, but this memo highlights their importance. This memo focuses on 4 areas that include increasing accessibility to vaccine, providing opportunities for education, leveraging active duty personnel policies to promote vaccination, and ensuring engagement at the lowest level to acknowledge and address individual concerns. We're honest and upfront in acknowledging the department is confronting many of the same challenges that the rest of America is in maximizing vaccine acceptance. We're using every tool possible to increase vaccination and will continue to do so from the Secretary to the most junior leader. Last week, in accordance with the CDC issuing new guidance on masking, the department announced that fully vaccinated DoD personnel can safely participate in most activities and are no longer required to wear a mask indoors or outdoors at most DoD facilities. Unvaccinated personnel, however, should continue wearing masks as required by applicable DoD policy to protect themselves and others who have not been fully vaccinated. To that end, we are updating our force health protection guidance to align with this CDC guidance on masking while ensuring that masks continue to be used in appropriate settings. We know our fight against COVID-19 isn't over yet, but the CDC's announcement underscores the fact that these vaccines work. They protect the recipient and their family members and will enable us to get back to normal. And lastly, as you're aware, the FDA recently expanded the emergency use authorization for the Pfizer-BioNTech vaccine to include adolescents 12 and above. We started shipping this vaccine Oconus on May 14th in anticipation of this decision, and there will be enough vaccine in place for first and second doses for all our overseas adolescent population. This authorization and our administration of vaccines to our adolescents is another significant step in our fight against COVID-19. DoD is committed to vaccinating all of our eligible adolescents. And I'll now turn it over to General Place, who will speak more in depth about these issues.
Sure. Thanks, Dr. Adirim, and good afternoon to all of you here and on the phone. I'll briefly expand on Dr. Adirim's remarks regarding our vaccination reach. As she mentioned, as of this morning, 58% of the active duty force has received at least one dose, and 44% are fully vaccinated. That number continues to increase every day. Senior commanders, military medical leaders, fellow service members, and family members are all contributing to the increased vaccination rate. As Dr. Adirim also noted regarding the emergency use authorization of the Pfizer vaccine for 12 to 15-year-olds, last week we began shipping the Pfizer vaccine to support our overseas adolescent community, and those vaccinations actually have already begun. We continue to ship the vaccine to many installations in the United States as well that did not yet have the Pfizer vaccine. For those military installations that in the United States that don't have the Pfizer vaccine, we're encouraging beneficiaries to obtain their vaccines from local civilian providers, pharmacies, or other outlets. Now that we've moved from a supply-constrained environment to a desire-constrained environment, we don't anticipate any challenges with access to vaccine in either the military or civilian settings. As Dr. Adirim also noted, our case rates and hospitalization rates are well below civilian rates. As of this morning, we have 29 inpatients in military hospitals worldwide that are COVID positive. I would point out that our hospitalizations are at the lowest number within the department since June 12th of 2020, and only slightly higher than they were in early June. The lowest number that we have consolidated records of was on June 7th, 21 inpatients. Another indication of the degree to which the vaccine is keeping people healthy and out of the hospital. As a military force, we continue to learn and adapt our strategies to combat this disease. Earlier this week, I hosted a meeting with our allies and partner nations' military medical forces to better understand effective approaches in terms of both treatment and vaccinations. I'm grateful for the contributions and collaboration of so many medical professionals throughout the United States and across the world. Finally, another thank you to our service members and other DoD personnel who have chosen to get vaccinated and continue to encourage their fellow service members, family members, and friends to do the same as well. Thanks again for joining us today. I look forward to your questions.
Thank you very much. First question, Macon.
First, is the memo going to be sent around or put up on defense.gov?
That memo should be on defense.gov right now.
Perfect. Other question about lifting of the mask mandates, and probably for General Place. Whose responsibility is it to maintain accountability in workplaces or in units for who's vaccinated and who's not, who should be wearing a mask and who doesn't need to?
Sure, that's leader business. And so where you're a member of a unit, of course, commander's business. Where we're civilian employees, then we use the appropriate, labor law or internal discipline like we do for the thousands of regulations and rules that we have for everyday business. It's just another one of those rules.
For Dr. Adirim, what's an example of leveraging policy to promote vaccine take rates?
Sure.
As said in the memo.
Sure. Our commanders have wide authority to use personnel policies. So, for example, one policy that is not necessarily a commander, but one of the policies of people who are vaccinated do not have to quarantine pre and post travel, but if you're not vaccinated, you still have to. That's an example of one policy. With regard to what commanders have control over, they have control over leave, so they can give liberal leave, for example, to those who get vaccinated. So.
Next question, we'll take one by the phone. Peter Lowy.
Hi, thanks very much for doing this. I wanted to ask about South Korean troops being offered the J&J vaccine. What other countries are being offered the vaccine through the U.S. military? What other countries have asked for the vaccine through the military? And have U.S. forces in Japan been asked or offered to vaccinate to prepare for the Olympics?
Did you want to start?
Sure. So just like we do for all allied partners or other nations who have dialogue with the United States, the policy decisions are made by the policy decision makers led by the White House and the President. Our job is to execute against those policy decisions. I am currently unaware of any changes in any policy decisions for us to execute against. In terms of the Olympics, ma'am, that's not something I know anything about.
Yeah, no, I have no awareness of that. But as General Place said, these are decisions by policymakers above our pay grade, and we're not aware of anything that we have been told to support at this time. So.
Great. Next question. Gianni?
Thank you. Doctor, I have a question for you. The CDC has stopped monitoring breakthrough infections among the vaccinated individuals. Now, all started, everybody started to take off their masks. Are there any new guidelines for the breakthrough infections for the CDC or your DOD?
We are continuing to test those individuals who are symptomatic, just as we have before. We are also continuing to test under our current force health protection guidance under those circumstances that we need to. For example, those individuals who are not vaccinated, I know that wasn't what you had asked, but those individuals who are not vaccinated may have to be tested before travel. So we're currently under our current force health protection guidelines with regard to testing.
So are you going to search if people dying because of breakthrough the infections, that
from vaccinated
yeah.
individuals?
Yeah.
Right. The vaccines are extraordinarily safe. People are not dying from infections. In fact, what the data and the science has shown us is that the vaccine prevents serious infections, hospitalizations, and deaths. So,
Ma'am, if I could even amplify that just a little bit. So one of the decisions that the Department of Defense made almost a year ago was to activate a COVID-19 registry, which is a database essentially of all of our beneficiaries, all of our patients who've ever been tested positive. And we also have the same sort of database for everybody that we vaccinated. So even though the CDC isn't requiring it, we still track it. So what I can tell you as of the first part of this week, which is the last time I saw the data, of the 1.5 million or so, just short of, who are fully vaccinated, we've had 1,640 some, I don't remember the exact number, again, it was earlier this week, but about 1,640, 1,650 that were breakthroughs. Of those 1,650 or so that were breakthroughs, we've had 24 hospitalizations. Of those 24 hospitalizations, we've had 0 deaths. So the department does track to that level of detail exactly what's happening to whom. The good news to all of that, as opposed to the 95% or whatever rates that we're seeing published from the phase 2 or phase 3 clinical trials, if you do that math, 99.9% effective for our beneficiaries of preventing breakthrough infection, and 99.999% effective in preventing hospitalization, and 100% in preventing death. Now, that's all comers, right? It's all vaccines. So that's the Pfizer vaccine, the Moderna vaccine, and the J&J Janssen vaccine. But that's the data that I can at least globally share with you that I track as the director of the Defense Health Agency every week.
Do you have anything data about the overseas troops they have involved with the breakthrough infections? Anybody? So any number of
right. So it's a great question. The numbers are too small. I mean, 1,640 some breakthrough infections isn't a large enough number to be able to do regression analysis and look at specific factors that may increase or decrease risks around the world. It's just not a big enough number. And that's a good thing, right? It's good that we don't have that many breakthroughs. But when we talk about safety and efficacy, in particular efficacy, that's why we keep talking about it within the department, is 99.9% effective in the community for us, and 99.999% effective in preventing hospitalization. That's incredible.
That's why CDC stopped monitoring. They don't do any more of this. Probably. Thank you very much.
Next question. Caitlin?
Yeah, I wanted to come back to what you said about moving into a desire-constrained environment. Can you talk a little bit more, tell me what that means?
It means people want it. So before it was supply, there's more people who wanted it than we had vaccine for. Now, based on the increasing manufacturing and those that really, really wanted it largely have gotten the vaccine. And now it's people on the fence or people who, quite frankly, for whatever their personal reasons have decided not to. So to the point that Dr. Adirim was making is how can we get in that information space? How can we really show people true data? It's one of the reasons I'm pounding a little bit hard on how effective it's been in our community, because I think there's a lot of people who think it's not an effective vaccine. These vaccines, this suite of vaccines are incredibly effective. So it's about how do we inform what is the real decision that you're making? So when I say desire-based, it's what's in it for me, right? How do I see value to this for me? Or how do I see this for value for my kids? And one of the interesting things I think that we're going to start seeing is that some parents with adolescent kids who want their kids vaccinated, the kids are going to say, hey, Mom, hey,